Hello Year 11 and welcome to your next PSHE lesson focusing on health and well-being. Today we'll be focusing on accessing services and trustworthy websites. So the first thing I would like you to do today is to please go and fill out the attitude continuum document that I have attached on Share My Homework. And it's a document that looks a little bit like this. Essentially you've got 7 statements all to do with things about support services and health and well-being. And I'd like you to read each statement and put on the scale here how much you agree or disagree with each statement. Now, you don't have to print this off or anything. You could just write down your statement 1 and put the number of where you agree with that statement or disagree with that statement. But I just want you to have a read of each of those statements and just begin to think about each of them, because it'll be a nice way into the content that we're going to cover in today's lesson. All right, so you can pause the video, go and look at that document, or you can see it all on the screen here. I'll scroll down slowly if you just wanted to look at it on the screen and make notes on your book, on your piece of paper, whatever it is that you're using. But please play the video again once you have done so, and we will carry on to look at the main content of today's lesson. Okay, hopefully by now you've managed to have a go at doing that. So remember, your task was to score each point between 1 to 10 as to how much you agreed or disagreed with each statement. Just bear those scores in mind as we move on through the rest of today's lesson. So, accessing services and trustworthy websites. By the end of today, you should understand what services the NHS offers, understand how to access accurate health information, keyword there being the accurate part, and to understand some of the different factors that can impact our health, all right, and just being aware of how we can work around those. So first things first, the first statement on that sheet there was technology helps us to support our health. Do you agree or disagree? All right. Let's have a look back, see what you've scored for that one. Did you agree or did you disagree? Now, admittedly, if we were in class right now, what we would be doing is having a discussion about this. But I'm going to aim to provide pros and cons, sort of the agree and disagree side for each of these points as we move through, just so you get sort of a full picture of each point. So when it comes to technology helping us to support our health, it can be both good and bad. It really depends on how you use it. So some of the advantages might be that you have online access to the NHS and other health services, which is especially important at the moment with everybody being trapped at home. I know a lot of doctors' surgeries are now offering online consultations where there's obviously been a large reduction in people actually being able to physically go. And it's the same with hospitals. You know, phones I know are being used a lot more. Essentially other methods of contact that don't require people being there in person to obviously help reduce the risk of transmission of what's going on. Obviously those services are still available if they are needed, but they have been significantly reduced to try and keep everyone safe. But I say this online access technology I know has been really, really useful in our current circumstances. Other advantages, you've got certain apps that allow us to track our food and exercise. If you're somebody who's on a bit of a health kick and you're wanting to track your daily intake, or you're wanting to track your exercise, there are plenty of apps that do allow you to do so, and those can be really, really useful. And I say, in recent months, it has allowed people to receive treatment in a safe way, okay, with everything going on. Some of the disadvantages of using technology, prolonged use of certain technologies may affect your physical and mental health. And this isn't just talking about health technology, it's just talking about technology in general. You hear a lot of studies about how prolonged use of mobile phones or prolonged screen time could have more of a negative effect on somebody's health. And another disadvantage there, and this is something that was brought up in previous lessons where I've done this, is that technology often allows you to be entertained while you're sitting down, which means people are less likely to move as much. Okay, it might mean that you know, you might get home from work or from school one day and you might sit there with your phone or on a game of some description. Before you know, hours have passed. It does happen, all right, because it's so convenient and so easy and it's there, all right, it might be having an impact on us in that way. But linking back to this idea that technology can help us to support our health, that we get online access to the NHS and other health services, there are some websites that I have been asked to direct you towards, which I will do now. So first things first, we're just going to look at the NHS services website. So if you were ever wanting to know what help you can get through the NHS, this is the place to go. You could literally go onto Google and type in NHS services, and this is what would pop up. All right, because obviously the NHS covers a really wide range of things. You've got GPs, your doctor's surgery, all right, prescriptions and pharmacies, hospitals, mental health services, all right, if you're visiting or moving to England, if somebody was coming over for a holiday and they needed a bit of advice. All the information is there, but if you wanted to find services near you, all right, you could click on there and it would come up with all the links, and you could click on whichever it is you think you require and go from there. Generally, if you have an issue, your first port of call should generally be the GP, unless it's a bit more specialised. For example, if it's something to do with your teeth, then you're going to want to contact the dentist. If it's something to do with your eyes, you probably want to go and visit the optician, unless it's an emergency, of course, in which case do go to the hospital. But as I've talked about in many other situations before with these lessons, generally, if you feel something's not right, go and speak to your GP. But yes, you can click on any of these. It'll ask you to type, your location in, and then it'll find the services near you. And that's the same for all of the options on here. But yes, if you ever needed to know whether you could get help through the NHS for something, this is the place to go. Okay. And obviously the NHS does cover such a wide range of things. I can't say that they would help you with absolutely everything, but on the whole, for general health and well-being, they will be there, or at the very least they can point you in the right direction if it's something that they can't do themselves, or like their GP. And this is why I say the GP is a really useful first port of call, because at the very least they should be able to say you need to go here now, all right, and they can give you that guidance to move on. But some other websites have been asked to direct you towards. First of all is this one here, the Sexual Health of Cornwall and Isles of Scilly. Again, we're talking about technology and how that allows things to be done. It makes things a lot more accessible, all right? And especially when it comes to perhaps more sensitive subjects such as this. If you ever found yourself in a position where you needed to find out a bit more information about sexual health, or you ever needed to gain some guidance on anything related to it, services like this are available, and they are available through technology on websites, okay? So if you're ever nervous about actually having to speak to somebody about it, you can go to somewhere like this to try and seek help. And websites like this, so this one is specifically for Cornwall. If you were in the Plymouth area, there's a slightly different one. It's called SHIP, Sexual Health in Plymouth. All right, but essentially what these websites do is they list all of the services that you can get. So if I go to this tab here, how can we help? They aid with things from STI home testing, the contraceptive pill, online diagnosis and treatment of particular STIs, young people services, all sorts of things, as you can see in that list there, along with information and advice, people you can speak to, or advice that you can be given so that you know what to do moving forward, STIs, contraception, pregnancy and sexual health, and all those kinds of things. And this website is here to be used, okay? If you do ever find yourself in a situation where you do think you might need some help with a situation like this, this is one of the places you can go. And it's similar with the SHIP website. All right, you can go to our services, and it's got a list of all the different things that are provided. Obviously, services are slightly different at the minute with everything that's going on with COVID, but that doesn't mean you shouldn't get in touch if you do feel there is something you need to talk to them about. They will work ways around it in order for you to be, seen if you need it. But yeah, these websites are here. You could just go into Google and type in, so for Cornwall, it's Sexual Health Cornwall, and for Plymouth, it's SHIP, Sexual Health in Plymouth. Make a note of these websites. You can see the links up here if you wanted to. But I say, if you ever found yourself in a situation where you needed help with regards to sexual health, these are the places to go to seek that advice and guidance, and they'll be able to tell you where to go next, okay? So yeah, these are just some extra bits of information about how technology is supporting the healthcare system. Like we've said, there's online medical records, remote monitoring tools, wearable technology, and telemedicine and telehealth. So it doesn't just come down to the fact that technology can be used, especially in situations like now, for more contact between sort of doctors and health professionals and those who and the patients who need support. But it's also things within the hospital and within health services themselves. So where people's health records can now be kept on file online rather than great big paper packs as they used to be. And I say wearable technology. I know people who have to have their blood pressure tested regularly. They can wear a little device for sort of 24 hours and carry it around with them. And say the way that technology does develop over time really does aid in areas including healthcare service. Looking at point number 2 then, it is easy to ignore advertising to products that are less healthy. And I asked whether you agreed or disagreed. And we can think about this a bit more widely, it's about how that advertising is really portrayed to us through the different formats. You may have noticed over the past, if you are a social media user, you may have noticed over the past couple of years, advertising on platforms such as Facebook, Instagram has really expanded. All right, when those platforms first began, advertising wasn't quite as common, but now because they're such a commonly used format across the population, advertising has come in more and more. So you might have noticed things there, you might have noticed things on the telly, or perhaps on advertising out and about. You often see in bus stops. There can sometimes be like fast food advertisements and things like that. So yeah, again, I asked you if it was whether you agreed or disagreed, and whether or not it is easy to ignore the advertising. And again, I'll try and provide sort of both perspectives, but I will just talk a bit more about advertising for products that are less healthy in a bit more detail. So these are some of the examples that I've pulled up of how sometimes food is advertised by particular places. So you've got the McDonald's burger on the left here, the thing you want when you order salad, all right? You've got the chocolate pudding here from Marks and Spencer's. If you've ever seen a Marks and Spencer's advert, they always try and make the food look very appealing and a bit posh. And obviously the entire purpose of these adverts is to get people to come and buy it. All right, so that's what advertising is for. They want you to come and buy their products and spend your money at their premises, at their place. Same with the Domino's pizza here. They're trying to make the pizza look really, really appealing. All right. So when we talk about whether or not this is easy to ignore, it's one thing that's really good to be able to do is just to be aware of advertising and what they are attempting to do, because you might see something, you know, like this. If you know this advert here is clearly targeting people who, you know, are potentially trying to make the healthier choice and going for something like a salad, and almost kind of trying to persuade them that no, they actually want the burger instead. You know, you see pictures of nice puddings like these, people might think, oh, that looks quite nice, I might go and buy one. The same with the pizza, you know, they're trying to make it look really, really appealing so that people will go and buy it. And if you're aware that that's what these advertisers are trying to do, it's often easier to kind of turn and go, no, okay, you know, I need to ignore this because I can see that they're trying to make me go and do this thing, and I'm choosing not to. I mean, obviously, the key to a lot of things is moderation. I'll talk about that in a bit more detail later. And even when it comes to things that are less healthy, part of that kind of healthy balanced diet, so long as things are taken or eaten and consumed is probably the better word, within moderation, all right, which means not going to excess. Just about anything can be part of a healthy diet, all right, any food, even the foods that might fall on the less healthy side of things, all right, so long as you're conscious of you know, your consumption of them, and you're conscious of it being done in sort of a moderation, in a way that, yeah, things are eaten in moderation, then it can still be part of a healthy diet. But again, with all these different places wanting to advertise to you and wanting you to buy their products, and especially with the advertising being so common within sort of our lives, again, all the different platforms where you can see, you know, newspapers, magazines, online, you know, there's very rarely a website, any website, that doesn't contain some form of advertising. And the same with social media now. You know, I know that they can often see your preferences, and you know that if you click on an advert for one thing, more of those things might pop up as you're going through. All right, so advertising is very much part of our lives, and it's really good tactic for us to just be aware of it, aware of what the advert is trying to do. On the whole, they're always trying to persuade you to do something. Okay, so it's just being aware that that's the intention that's going on here, and how to kind of ignore it in that sense. Okay, just so that we can continue to maintain that sort of healthy lifestyle, and yeah, just to be aware and be able to ignore the advertising for products that are less healthy, if you know that's a situation we need to be in. But interestingly, did you know the government is banning junk food advertising on TV and online prior to the 9 p.m. watershed? Which the watershed refers to the time of the evening where certain things aren't allowed on the telly, sort of like swear words or particular things which aren't allowed to be featured on the telly prior to that 9 p.m. watershed, as part of a 10 million campaign aimed at tackling obesity in response to the COVID-19 pandemic. All right, so this is what they're looking at doing. So it would be things obviously like restaurants and takeaway services and food that falls into that less healthy category that would be banned from being advertised. And the purpose behind this is obviously so that people, because with the way that advertising works, you know, you might see an advert and go, you might see an advert for pizza and go, oh, that looks really nice, I think we should now have a pizza tonight. Obviously food that ends on the less healthy side of things. And if that's something that somebody does regularly, they may end up consuming more of the foods that fall on the less healthy side of things than maintaining a balanced diet overall and eating things in moderation. So this is why they are looking into this. But my question in a moment is going to be, you know, do you think this is enough to simply stop it happening before 9 p.m? Now, the move is considered to be a big step forward for making healthier choices easier. Mr. Hancock said, I'm determined to help parents, children and families in the UK make healthier choices about what they eat. We know as children spend more time online, parents want to be reassured that they are not being exposed to adverts promoting unhealthy foods, which can affect eating habits for life. Again, you know, it can happen to anybody, but children as well, if they're seeing adverts for all this food that falls on the less healthy end, and you know that it's being made to seem appealing to them, then they're perhaps more likely to turn to their parents and go, oh, can we have this for tea or something tonight? So you know, these adverts will be having an influence on the decisions that these people might be making. And this will be a world-leading measure to tackle the obesity challenges we face now, but it will also address a problem that will not only become more prominent in the future. All right, so this is the rationale from Mr. Hancock about why they're deciding to do these things. But so my question is, do you think this is enough? Is it enough to simply stop showing these adverts before a certain time of the day? And it's an interesting one to talk about because obviously it is a step forward, as he says, but at the same time, and I say that these are comments that have come up when we've had these discussions in class before and with other groups. Although it is a good step forward and it's good that action is being taken, at the same time, these foods and whatnot still exist, regardless of whether or not people are being, shown them. So how much of an impact can it have is the question. And that's what we tended to discuss in class. Number 3, it can be difficult to make health-related decisions when the news provides conflicting information. Okay, and once again, I asked you if you agreed or disagreed with this statement. If you'd like to look back at what score you gave it, whether you agreed or disagreed, once again, I will talk about different sides of it. All right. But of course, there are times when the media can skew the truth, making health information misleading. So I would agree with this statement that it can be difficult to make health-related decisions when the news provides conflicting information. Now, a concept you might come across before are things like fake news or checking your sources or things like that. But I'm going to look at some examples of how the news and media in general can provide some conflicting information and how we can work around it, how we can figure out whether or not the truth is truly involved in those situations. So if I go over here, not yet actually, let's do this one. So generally, one of the things we need to look at is how you can judge if a source is reliable. And this is where it might be useful actually to have a look at this. So just one example of how the media might be skewing or giving conflicting information. We've got an example here of some medical news that was posted. I believe this is Facebook that this was posted on, but it's this headline here: that scientists find root that kills 98% of cancer cells in only 48 hours. Now, obviously, this is one of these statements that does seem a bit too good to be true, and I'll talk about that in a bit more detail, but this is the sort of news that might circulate in certain media platforms. I am aware that a lot of social media platforms have been looking to try and reduce this aspect of, ensuring that sources are correct and ensuring that fake news is not being shared on their social media platforms, obviously to avoid misinformation being shared, but things like this do still exist. But if we look at this here, so it says this potent root builds up blood and immune system, cures prostate, lung and other cancers better than chemotherapy. So it's making some really big statements here, right? Making some really, really, really big claims, all right? But we need to be aware and we need to have the facilities to be able to sort of question things like this and to be able to go, is this real or is this not? I'm not saying that everything that might seem a bit ridiculous like this is false, but at the same time, we need to be able to have the knowledge as to how to question it. So if I go back here now, how can we judge if a source is reliable? Okay, and I say you shouldn't be afraid in any situation to always kind of question the sources. All right, to be able to look and go, do I trust this? Yes or no? Where's it from? Okay, because different news outlets and different media platforms might skew things and word things slightly differently to try and put across a particular viewpoint. So if we look here, number 1, first of all, we want to look at the source of the article, check that it's from a newspaper, website or broadcasting organisation with a good reputation. Okay. That's always the first thing to look for. And it's always a really good skill to have to kind of, if you read something, to then go, who is saying this? How much would I believe them? Okay. For example, with health information, you should be more likely to judge, believe what the NHS is saying than what Bob shared on Facebook. All right, it's judging those sources and finding out where this information has come from and having the facilities to do so. Number 2, ask yourself whether this finding is really plausible. If it looks too good to be true, it probably is. Okay, that's the reality of it. If they're trying to make these really big claims, like in that example I gave you, it's probably too good to be true. Otherwise, there'd be more information out there about it from reputable sources. All right, so again, I'm not trying to say that every single source that says something that sounds a bit too good to be true is lying, but again, it's worth kind of looking, going really, and then questioning the source behind it, looking into the research behind it. Number 3, if it's described as the secret that even doctors won't tell you, then be wary. Doctors have little to gain by keeping effective treatments a secret. They want to cure people. That's what they're there for. But you will often find some information, sort of saying, oh, teachers don't want to tell you about this because be wary of it. Okay. And again, something to question. Number 4, the bigger the claim, the more evidence you need to see that it's true. So if somebody is making a really big claim, saying something that looks, it might be too good to be true, it is something that you do need to question. Look for the evidence behind it. If this really is a massive breakthrough, and of course massive breakthroughs do happen, it will have been tested on thousands of patients, published in medical journals and covered by the biggest media around the world. Look at the progression of the COVID-19 vaccine. As soon as breakthroughs happened with that, it was on the mainstream news, BBC, Sky News, ITV, it was all over the place, okay? And it was tested on all these different people, published in medical journals and things like that. So it had the backup to prove that it was correct and that it was true. However, if it is something so new that just one doctor is recommending it, you would do well to wait for some more evidence before following any health advice. Okay, make sure it is something that has been through those rigorous testing processes and is something that is being, you know, sort of used more widespreadly. Number 5, if the article says that research has been published in a particular journal, do a quick search online to check that the journal is peer reviewed. What this means when a journal has been peer reviewed, it means that before the article is published, it has been sent up for scrutiny by scientists working in the same field. So somebody has written a thing, they've sent it out to other scientists and they've checked to see if they agree with it or not and whether the information is mostly correct. Occasionally, even peer reviewed papers have to be retracted if the results are later discovered to be fraudulent, but the vast majority do stand. So essentially other people are backing up what this person is saying, and that means it's more trustworthy. If the research has not been published in a peer-reviewed journal, be more skeptical about it, or be wary and do question it a bit more. Okay, if other people have not chosen to peer review it, why have they not chosen to peer review it? Okay, because again, having it peer reviewed means that it's more likely to be truthful and more likely to be a source that you can trust. Carrying on then, with number 6, has the Wonder treatment been tried in humans yet, or only in a test tube or in mice? If human trials haven't taken place of this particular medical miracle that's being described, the treatment could still be interesting scientifically and it could show promise, but it's too early to say whether it will ever be a viable treatment for people, okay? So you could have somebody come out and make this big claim about something, but again, if it's not gone through these testing processes yet, then, you know, that at the moment their claim could be, you know, unsubstantiated and, you know, not worth considering just yet, because we don't know if it's what the claims they're making are truthful because it hasn't just been tried out yet. Number 7, the web can save you a lot of time. Check it out on a website that reviews media coverage of news such as Health News Review, and you might find they've done the hard work for you, and there is a website I will guide you to in just a moment. They sort of look at what is being published, and they will talk about the science behind it, the evidence behind it, whether or not it's a website that you can trust. Number 8, if you can't do that, search for the journalists' names to see what they usually write about. If they regularly write about science or health, they're more likely to know the right questions to ask about a new treatment. If they've never written about anything to do with health before, again, it's probably something just to be wary of and just to be skeptical of. Number 9, do an online search for the story's detail plus the word myth or hoax. You might find it's already been critiqued elsewhere, which means this particular breakthrough or this particular article or this particular news part that you're looking at has already been questioned by somebody else. And they can probably shed more light on the situation. And then finally, number 10, once you've established that a health story isn't fake and has been published in a reputable journal, if you're in that situation, you might still want to check the methodology of the research. And there's one website which I'll look at now, NHS Behind the Headlines, which looks at studies in detail, discussing how they were done and whether they've been reported correctly in the press. So if I go to this website here, you should just be able to type in NHS Behind the Headlines, and essentially they've got a lot of information where they've taken news articles or big claims that have been made or are out there in the world, and that they're sort of explaining some of the real science behind it, so they might confirm if it's true, whether it's false, or talk about what information it is that particular news outlet has kind of taken and skewed or presented in a particular way. But these websites do exist here, okay, for use. To help us know whether or not what we're looking at is correct. Moving on to number 4 then, it can be difficult to make healthy choices because of personal circumstances. And I asked you whether you agreed or disagreed, so we just want to refer back to see where you found yourself on that scale. But one thing we need to consider with this statement is what factors will play into how we make choices around our health, okay? So there are many, many factors that do influence our health, okay, as you can imagine. And these are called determinants of health. And one kind of determinant of health is what is in our genes and our biology. That's one aspect of it. Or how your body perceives certain things. You know, somebody might find themselves allergic to this or that, or intolerant of this or that, which obviously is something that will have an impact on their health. But another determinant is our individual behavior. So aside from our biology and the science behind what goes on in our bodies, it's also the external things that we do and our individual behavior with regards to our health and our well-being. And this could include things such as whether people smoke, exercise, or eat a balanced diet. All of these things are going to have an impact in some way. Many people assume that their health is a result of their genes, their behaviours, and how often they get sick or go to the doctor. But it's not just how you live that determines how healthy you are. Social and physical environments have a big impact on our health too, and these are called social determinants of health. So personal determinants you've got are what's going on with your biology, and then also the choices that you make with regards to, how you live, and yeah, and the individual behaviours that you do in regards to your body and your health. But there are also external factors, things that occur almost to us from the outside, that can have this impact on our health, and these are these social determinants of health. So what are the factors that can play a part, you know, sort of on the outside, things that we don't really have control over as such? And these can be things such as access to nutritious foods, access to clean water and working utilities, such as electricity, sanitation, heating and cooling. For example, if your electricity goes off for a month for some reason, there might be a fault in your area, that's going to have an impact on how you live and, you know, what things you have access to. Early childhood social and physical environments, including childcare, ethnicity and culture, family and other social support, gender, language and other communication capabilities, occupation and job security, sexual identification, social status, which means how integrated or isolated you are from others. Are you amongst a big family or a big group of people? Are you on your own? Social stresses such as exposure to violence, socioeconomic status, spiritual religious values, access to healthcare, your income and housing. And these are all social factors which could have an impact on your overall health and well-being. So it's just good to be aware of that. And one thing I will say though is that regardless of the situation you might find you in, where possible, whenever possible, it is of course wise to make the healthier choice, okay, in order to maintain a good level of sort of health and well-being and to be leading a healthy lifestyle. And a key part of this, as I kind of mentioned earlier, it's having everything in moderation. Now what moderation means is the avoidance of excess or extremes, especially in one's behaviour or political opinions. In this example, we're mainly looking at behaviour here. All right, but eating, for example, eating things in moderation would be, you know, keeping to perhaps portion sizes, or ensuring you're not kind of going above and beyond daily calorie intakes, or those are just examples of things. Okay, again, each individual person is different. Every single body works differently, so you do what is best for you. Okay, but I say that is the key, is keeping things again, is avoiding excess or extremes in those particular behaviours. Looking at number 5, and this kind of links back to number 4 as well when it comes to social determinants of health. The local environment, including local shops and services, can have a big impact on our health. I asked you whether you agreed or disagreed. I'd like to look back at your score again there. Just to see where you found yourself. And on the whole, I'm going to agree with this one. So if I put these two pictures on the board, on the left you've got a picture of Plymouth, on the right you've got a picture of the coastline somewhere. I can't quite remember where that is. But I put these two pictures up, and what I want us to think is, what do you think the difference might be between one and the other? With this awareness that our local environment, including local shops and services, can have a big impact on our health, what might the differences be between these two locations that might link to the local shops and services? And what different things might be available in different areas. All right, and this is one of the key things to remember. So when you do get kind of larger cities such as Plymouth or other areas all over the country, you are because you've got the much denser population, you've got many more people in that one area, you're more likely to have things such as, you know, more doctors' surgeries, more hospitals, or closer hospitals, at least. Obviously in Plymouth, you've got Derriford up the road. And if you look at most major cities in the UK, they will most likely have at least one hospital linked to them. You're going to have more access to shops and different food shops, markets, you know, a much wider range of things will be available to you. All right, in city scenarios. And that's just in comparison to places that might be a bit more remote, a bit more in the countryside. It's more likely that health services will be further away. Obviously, doctor services are normally relatively close, but you know, if you needed to visit the hospital, you would likely have to travel further. Because there's less people living there, it's more likely that there'll be less sort of shopping facilities available, so there will be fewer supermarkets, which means you might not get as much choice as to some of the foods that you were able to access, or how much those, you know, those prices cost. If you've got somewhere that's got lots of different supermarkets, obviously supermarkets tend to charge things at different prices in an aim to compete with each other, which means that, you know, if you wanted to shop a bit more cheaply, there are certain shops you might go to, or vice versa. If you wanted a bit more luxury, you might go to other shops and spend a bit more. But again, if you're in a remote location, you might only have 1 or 2 shops, in which case you don't get much of a choice. Okay, you're kind of limited as to your options. But then on the flip side of that, if we're then also looking at kind of services, you could also talk about things such as access to open space. All right, obviously one part of maintaining a really healthy lifestyle is getting regular exercise, and in somewhere like city centres, although it is possible to do so, of course it's possible to just go out for a walk or do whichever exercise you might choose. There might be less access to green spaces, so big open spaces where you can go for a walk around or do exercise or play football, ride your bike. which means that people might be less likely to do so because the areas and the space isn't there as much. Well, I know there are some nice green areas in Plymouth, absolutely, but other cities might not have the same facilities. Whereas obviously in places that are a bit more remote, in the countryside, you've got much more green space available to you, you know, more facilities for things such as cycling or exercise. You've got the sea there. You could use that for exercise, swimming, or various things. So it is kind of weighing it up on either way, but the main point I'm trying to make here is just being aware of what services are available to you, what your local shops and services look like, and how all these things can have an impact on your health. And yeah, just linking back to what I said earlier, you know, what facilities you have available to you can really have an impact on, you know, your health and well-being. If you lived in a really, really tiny town that only happened to have, you know, Premier stores, although they do sell a really wide range of things, they might not sell as much of a range as some of the larger supermarkets, such as Waitrose and Morrison's. They might not sell things such as fresh fruit and vegetables, or quite as large of a range of things that allow you to maintain that sort of healthier diet or healthier lifestyle. Okay, and that can obviously have an impact, and that would be a social determinant of health, because that kind of lack of access to things. And it'd be the same as well, because these shops are obviously a lot smaller than supermarkets. They wouldn't be able to stock as much stuff. Yeah, it's just being aware that, you know, if you have to solely kind of live out of a corner shop, then that might be having an impact on your health, and it's just something to be aware of. And again, in that aim to be maintaining that sort of healthy diet and lifestyle. Whereas obviously, if you do have access to places such as Morrison's and Waitrose, and you know, they're going to have that larger range of things that you can go and get, that will allow you to make more informed decisions around your food, and be able to carry on leading that sort of healthier lifestyle. Okay. Yeah, and so this is all about just maintaining that awareness of how these different factors could have an impact on your life. Okay. So, of course, like I've been saying, it is possible that your local environment can have an impact. Therefore, it's important to understand what services are available within your local area, such as where your local health services are. All right, you can use the NHS website for this. So what I'm saying at this point is, say, for example, you moved location, all right, you might get a bit older, you might go to university, or, you know, you might find yourself in a different place to where you are now in the future. One of the first things that's really important to do is to use the NHS website to find out where your local services are. Find out where your local GP is, your dentist, the hospital, pharmacies, should you ever need them. And you can use that website that I looked at right at the beginning, or the NHS website, where you can type in your location. It will bring up all the information for you. Okay. What you should also do is make yourself aware of the local shops and what they offer. All right. You might have a really tiny corner shop just across the road, but then you might also have a Morrison's halfway up the road, or half a mile away, let's say. In which case you then know that you have the option. Obviously, it's really convenient to have the corner shop there, you know, for bits and pieces. But like we talked about, if you want to be able to have more options with regards to your shopping, ideally you need to go somewhere a bit bigger. So although it might be a little bit further away, it might be more worth the visit to go to the shop half a mile up the road, so that you have access to those range of different foods. Okay. Again, it's just really good to be aware of what is nearby. If you move to a new place or anything like that, it's always good to have explore a little bit and see what's nearby. But another thing it's really good to do is to become accustomed with other community services in your area, such as public transport or any local groups. You know, if you're somebody who perhaps doesn't have a car, you're going to be relying more on public transport. You're going to want to know what transport is available to you, where it goes, how often it arrives, how much it's going to cost, things like that. But also perhaps local groups. All right, you might want to get involved with the community, make new friends, or do things like that. And so a lot of this information can often be found on sort of town websites or through sort of Facebook groups or things like that. All right, I do know that a lot of towns and cities now do actually tend to have Facebook groups, which are like community groups, that, you know, people can post and saying, I'm looking for this or I'm looking for that, has anyone got any advice? And those can be really useful forums to get into, and, you know, to help you find these different facilities if you ever need help, especially if you're in a new area. Okay, number 6, the last 2 points here won't take us quite as long. There are people who can help us resolve problems with housing and work. I asked you whether you agreed or disagreed. There are people out there, yes, you just need to know where to find them. So for one example here is the Citizens Advice website, and they can help you with things to do with housing. All right, housing issues will always arise, and therefore you need to know your rights and responsibilities. You could also find yourself threatened with eviction if that was ever a situation you might have found yourself in. But on these pages and on this website, information can be found about how to go about renting or buying a home, or just finding somewhere to live. So if you've ever found yourself in that situation where you needed to find somewhere, it's websites like this that can really, really help you with that. And as you can see, they have advice to do with renting privately, renting from the council or a housing association, homelessness, repairs in rented housing, or renting a home, where they've got all this different information. So if these are things you need to know, if you know you're in that situation, sources like this can really be very useful in finding out more information about what to do, where to go, and how to get the help you need. And similarly, when it comes to jobs, you have websites such as gov.uk, which will not only list information about what jobs are available to you, but also more information to do with working, jobs and pensions. So there's things to do with the armed forces. When it comes to finding a job, you could apply for some help to do with job interviews. There's apprentice information, career skills and training, jobs to contact the job centre, criminal record checks, finding a job, finding a traineeship. They've got all this different information, and they also include information to do with holidays, time off, sick leave, maternity and paternity leave. It's all about understanding your rights with regards to the workplace once you're in there, and then also to do with redundancies, dismissals and disciplinaries, and then also to do with your state pension as well. All this information is kind of here on the gov.uk website, and there are also a host of other information websites out there as well to do with jobs, recruitment websites, or if there's a particular brand or person you're thinking about applying for a job for, you can always go to the website directly or contact them directly. All right, but this is another reason why technology is so useful to us nowadays. All of this information is available online, sort of, and immediately. So if you ever find yourself in a situation where you do need any of this advice, these are some of the places that you can go. So make a note of the websites if you need to, for later reference. And then finally, number 7, if we are unhappy with health-related issues in our area, we have the power to do something about it. I asked you if you agreed or disagreed. Yes, once again, you do have the power to do something about it, but again, it's knowing where to go. There are particular channels you need to go down. And the main thing I would say is that if in your area you have a major concern or issue or something you really want to discuss, the main person to go to would be your MP. Now, Miss Cheryl Murray, she is currently the MP for Tor Point, which is why I've included it on here. With regards to Plymouth, it depends which area you live in as to who is your current MP, but they would be the person to get in touch with. And once again, this would just be a case of going onto Google, typing in her name, typing in contact information, and this website comes up. It tells you the information of how to get in touch with this particular person. All right, and they should be the person that you can go to with any complaints or any issues that relate to your community. Or that's what they're there for. MPs are there to serve the community, so they should be the person that you can get in touch with. All right. That is it for today's lesson. So today we talked about what services the NHS offers. We talked about how to access accurate, being the key word there, health information. Again, never be afraid to question sources. Okay, you could even be having a conversation with somebody and they could say, oh, I heard this, and you could turn and go, what are your sources? Where did you find that information from? Again, it's always wise to be able to question things. Okay, even if you do find out that they're true, that's fantastic. All right, but always be wary and always be wise enough to sort of question things if you feel they're not quite right. And then we've also talked about some of the different factors that can impact our health. And again, the entire aim of giving you this information is just to give you that awareness of how the things around you might impact your health and well-being, okay, so that you know that you can make an informed choice moving forward about some of the things you might decide to do. But as I said, that is it for today's lesson. You will have a short quiz attached to this lesson on Show My Homework that I would like you to go and complete. And you also have another short video to do with apprenticeships that I've attached today. That I've been asked to attach as a short 10-minute video that's just there for you to watch, but I do need to know whether or not you watched the other video. So please fill out the quiz that I've attached, because one of the questions on there says, did you watch the apprenticeship video? Because we need to let them know who has and hasn't watched it, how many students have watched it. But that's it from me for today. All right, again, go and do that quiz, go and watch the other video. All right, but otherwise, I hope all goes well with the remainder of your remote learning, and I will see you again in a fortnight. Take care.